Welcome to Disease SNS. In this video, we will be talking about herpes infection and its types. Herpes is a viral infection which is caused by the herpes simplex virus 1 and 2. Herpes simplex virus 1 mostly causes sores or blisters around the lips or inside the mouth, which are sometimes called fever blisters or cold sores, while herpes simplex virus 2 mostly causes sores on the genitals. Herpes simplex virus is highly contagious. It is mostly easily spread or acquired when a person comes in direct contact with an infected person's mucous membranes, saliva, or the oozing fluid from a sore. You can easily acquire the virus from kissing, sharing drinking and eating utensils, sharing toothbrush, sharing sex toys, having an unprotected sex, and having many sex partners. It can also be transmitted from mother to child during pregnancy, breastfeeding and birth, especially if the mother have an active outbreak of the infection during this period. It is likely impossible to acquire the virus from toilet seats, because the virus cannot survive longer outside the human body. The two most common types of herpes infections are oral herpes and genital herpes. Oral herpes is primarily caused by the herpes simplex virus 1, although it can also be caused by the herpes simplex virus 2. It is an infection of the mouth, lips, or gums, which is normally acquired through contact with the virus in sores or surfaces around the mouth and in the saliva. It could happen during kissing, oral sex and other skin-to-skin contact. You can acquire the virus if you touch an infected person's cold sores, and then touch your own face shortly afterward. Many people acquire the virus during their childhood, as a result of touches and kisses on their faces by adults with cold sores. The virus can also be acquired through shared toothbrush, lip balm, drinking and eating utensils, although it is not common. If you have been exposed to the oral herpes virus, you may first experience tingling, itching, or burning in the area of exposure such as the lips, mouth, or around the face. This sensation can appear 2 to 10 days after exposure, and may last 24 hours, then will form sores or small blisters around these areas. This sores can last 2 to 3 weeks at a time before clearing up, although medications can shorten the healing time and can also ease symptoms. You can prevent oral herpes by avoiding kissing, intimate contact and oral sex with someone who has a cold sore. Ensure you do not share utensils, straws, glasses, towels, razors, lip balm or lipstick with someone who has a cold sore, and also wash your hands thoroughly before touching your lips, eyes, or genitals. The next is the genital herpes. Genital herpes is a very common sexually transmitted infection. It is mostly caused by the herpes simplex virus 2, but can also be caused by the herpes simplex virus 1. It normally causes blisters and open sores or lesions in the genitals such as the penis, vagina, anus and thigh. A person can acquire genital herpes by having an unprotected vaginal, anal or oral sex with an infected partner. The use of condoms and other barrier methods alone cannot completely prevent the contraction of the virus, since the sores can develop in other areas such as the anus and around the thigh, which are normally not covered during intercourse. Pregnant women are at risk of transmitting the infection to their babies, especially if they contracted the virus during pregnancy, and this can lead to premature delivery and other complications in the baby. They can also transmit the virus during delivery and breastfeeding. Pregnant women can prevent their babies from contracting the virus by taking antiviral medication prescribed by the doctor, and also considering a C-section birth. When you contract genital herpes, you may experience tingling, itching, or pains on or around your genitals 2 to 10 days after the exposure. This may last few hours, then form a fluid-filled blisters which will later burst and leave painful ulcers or sores. This sores can last 2 to 6 weeks before clearing up. But medications can shorten the time of healing and also ease the pains and other symptoms. You may also experience a painful urination, and flu-like symptoms such as fever, swollen lymph nodes, headache, unusual tiredness and reduced appetite. The best way to prevent yourself from contracting genital herpes is to avoid having sex with anyone that you are not aware of his or her health status, or when the person has an active outbreak. Herpes infection does not have a cure. However, certain antiviral drugs are available to prevent or shorten the outbreak, and also to reduce the chance of spreading it to others. Once you contract the virus, it remains in your body and keep recurring. Some people can have only 1 or 2 outbreaks a year, while others may have as many as 4 to 5 outbreaks a year. The severity of the symptoms is dependent on whether you are having your first outbreak, or a recurrent outbreak. The first outbreak is often more severe, and lasts longer than the latter. Exposure to the sun, stress, illnesses, hormonal changes from menstruation, and consumption of certain foods, are often the triggers for herpes recurrences in most people. You can easily transmit the virus to other people during an active outbreak or when sores are present, but you can also transmit it when no symptoms are present. Herpes simplex rarely causes any severe complications in most people. But it can cause complications in children, and people with weakened immune system.